guys, so last week we looked at laser hair removal on Emma's face. Oh, I can't see you here, Michelle. Oh, that's right, I'll turn the camera in. This is Michelle. She is the owner of MW Aesthetic Health, or Moi, based in Sutton Coldfield. We work together to sort of share clients basically. Between us we cover everything. I'm not an injector, but Shell is. Let me see, everyone needs to see you, sorry, just leaning across there. Shell does all the things that I don't. So she does fat dissolving injections, fillers, other injectables, the injectable for lines and wrinkles that we must not mention because you're not allowed to.
Yeah.
Also we both do the amazing Wow Fusion because it's fabulous, and we both offer LED Soluma light therapy as well. The one thing I do that Shell doesn't is the laser hair removal. So we're going to go live on my page, and then shortly when we carry on to different areas we're going to go live on Shell's page. So you're going to see a lot of us today. So what we're going to do is underarms for Shell at the moment. Now what you will discover is that laser hair removal when you use Soprano really isn't painful, but it can be a bit tickly.
Yeah.
So last time we did this for Shell, we discovered that her left underarm is really ticklish. Not her right one.
But my right one isn't.
So you can have a bit of a giggle while we get this done for her. And
have a laugh at my expense.
Yeah,
it's
all
absolutely
good.
fine.
It's all good. So, I haven't got my gloves on, so I'm just going to pop the gloves on. And we're nearly ready to go. So it's very important that Shell keeps me informed of how this feels, basically. If it starts to get too warm, it's her job to tell me, or if it feels prickly, it's her job to tell me, because otherwise it becomes not pain-free. So the client is responsible for keeping me informed on how it feels. So it can go from, hang on, it's getting a bit warm, to ouch, quite quickly. So if she says stop, then it means it's getting a bit warm, we'll readjust and carry on. Readjusting doesn't make it less effective, and that's really important to remember. It just adds a few seconds onto the clock, okay? So we've both got goggles on, very important. And obviously I hope you can hear us okay. COVID rules mean we have to do this with masks on because obviously we're in quite close proximity. So, as I said, anything more than comfortably warm.
I'm just frightened to be too cold now.
So if the worst thing you can say about laser hair removal is that it tickles, it can't be too bad, can it? So if you can stand it on the highest temperature, it will be done quickest. But don't try and be brave just because of that, okay? So here we go. Let's just tuck that in there. And if you pop your hand there for me,
Yeah.
I'm less likely to completely cover you in gel.
I'm
hoping over time this will get less tickly, Michelle. It might not. I know I shouldn't laugh and I should be terribly professional, but it is quite fun. Okay, so cold to start with. Okay, here we go. So just, wiggle your toes or something. You're doing very well actually, that's quite good.
I'm focusing on my toes.
Wiggle your toes. Not what you used to say when they gave injections for vaccinations, wiggle your toes. So no, you're doing very well, and if this isn't too hot, there's only 20 seconds left to go.
It's one of them, it's warm but it's not.
Warm, yeah, warm is fine.
Hot.
If it gets
out,
okay.
It just suddenly went quite hot.
So okay, so that's a good learning point. So what's important is that as you start to creep up, it will get to this, hang on, that's getting too warm, that's the point to say stop.
Okay.
If you try and explain it to me, it will go zap, like that. So I'm just going to speed up a bit at this point rather than reduce the heat. And that sometimes is enough. If it's not, say stop. We're nearly there anyway. We are 5 seconds from being done, but don't risk it getting hot.
That's fine.
There we go, done. That is one underarm, done.
That wasn't as Mr. Tickles as last time.
It does tend to improve actually. I do find people learn to tolerate the tickliness a bit better. So if you, that's not good. Poke in there with a stick. Have a wipe over with the paper, Sharon. I'll take that off you.
So is the different temperatures then, like, say you start off for like because obviously this is my second treatment, so does it get hotter each treatment?
No,
or?
I just start at the temperature I think somebody will be able to tolerate.
Okay.
But this is why I can treat black and Asian skins pain-free, because we can start at a much lower temperature, because instead of zapping energy in, it gradually builds it up. So I can bring the temperature right down for black skins, and yet it still gets the same amount of energy going to destroy the hair follicle, and doesn't risk burning the skin, causing pigmentation problems, which other traditional lasers do. You know, so black skin, you can't do laser hair removal on. Asian skin is a bit kind of, some you can, some you can't. But I see a lot of people who've had pigmentation problems from too much laser, basically. But that isn't the case with this. So this is brilliant for, I have a lot of Asian clients with facial hair. And so the Soprano is amazing for that, because it's not, doesn't have to be hot. It doesn't put them at risk of excess pigmentation as long as they look after their skin properly. So it's a really good laser for that. My mask is slipping today. It doesn't normally do that.
Obviously, doing what I do in my clinic, I have no.
Maybe this one's going to be worse.
No, it's just cold. I've got no experience of laser hair removal, so I don't know how it works.
Yeah, so traditional lasers, what you find is that traditional lasers will go, so I'm not doing anything yet, zap, 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 and all of the energy that's needed to destroy the hair is delivered in one hit. And so you can't keep going over the same area. So if you have to turn the temperature down, the amount of energy is reduced, so you might not get the result. Or if you leave the temperature up to destroy the hair, you can damage the skin. With this, it's a gradual increase in energy, and it's delivered slowly, so you're less likely to damage the skin. Drop that elbow out to the side a little bit further. That's it. So, okay, see how we get on here. Okay, she's doing very well.
Not as tickly this side.
This side isn't as bad.
No.
It's funny, isn't it? I would sometimes I do move around, but no, you're fine. But for the purposes of the camera, you can see exactly what's going on here as well, me standing this side. So you can see how the diode is moving over the skin. The gel is, it's a bit like ultrasound gel, just a little bit thicker. And it's very comfortable unless you're really ticklish, and you can see that that laser light is continually flashing over the surface of the skin. So the energy gradually builds up in those hair follicles, and it destroys all the growth mechanism and the blood supply of hairs in active growth phase. So all of those hairs will now fall out, or they should do. Any that are dark enough to absorb the energy will fall out, and the other hairs can actually be damaged as well. So, oh, my little screw's falling out. It's falling out.
But definitely pain-free. I can vouch for that.
So, I'm going to leave you lovely chaps there. Hopefully you can hear us with the masks on. If you want to watch more, have a little wipe over that. If you want to watch more, jump across onto Michelle's page, because in about probably about 15 minutes, we're going to do her legs. So yeah. I'll see you later.
I'm having an area I don't want filmed unfair, so we'll get to legs after. Bye.
See you later.
So can't we get